Kumar Dey, and I have with me Dipu Patel from USA as our co-host. So, what I thought today is that I'm going to kind of take over from Harshita for the introduction, and I've got some great news to share with you, folks. We started this podcast series about a couple of months back, and I'm really happy to say that we have a global reach out. We've reached out to a lot of audience across the globe, to be precise, more than 147,000 audience across the globe. And we've reached out to individuals across India, United States, Singapore, Hong Kong, UAE, as well as many various other countries in Middle East and Southeast Asia, just to name some of these countries out of probably 54 or 58 countries that we have reached out to. So that's a fantastic reach out, and it's only because of our audiences out there, because of your curiosity. And we've always felt that artificial intelligence is something that we need to be curious, we need to be adaptive in learning how it's evolving, and the space as which it is evolving throughout this whole landscape of the healthcare ecosystem. It is something which is fascinating, and the whole vision of this podcast is to keep you updated, keep you curious, and help each other learn something new every day. So today we have with us Sheila from USA, and Sheila has a vivid experience of working in this healthcare ecosystem in special context to the digital health ecosystem. And she has some fantastic ideas and visions and experience of how the AI is going to kind of change the landscape of this healthcare in terms of the hospital sector and in terms of the medical infrastructure. And to discuss that, Deepu and Sheila is going to take us over the next 30 to 40 minutes with their insights, with their experience on this evolving landscape of artificial health intelligence in the healthcare infrastructure. So without wasting much time, dear friends, I'm going to hand it over to Deepu. Deepu is going to introduce Sheila in details, and they're going to take us through this next 30 to 40 minutes, after which I'm going to come back with some exciting questions to both of them. Over to you, Deepu.
Thank you, Amit. Thank you so much. So I'm very excited to welcome Sheila Shah, who is a managing editor at LEK Consulting's Chicago office and serves as a leader of the firm's digital health practice. Sheila's experience covers a range of areas with a particular focus on healthcare technology, due diligence, commercial strategy, healthcare supply chain, growth opportunity assessment, and organizational design. Prior to joining LEK, Sheila interned at Janssen's Healthcare Innovation Group at Johnson & Johnson and worked in strategic sourcing at New York Presbyterian Hospital and EY's healthcare advisory practice. She holds a BA degree in economics and political science from Barnard College of Columbia University and an MBA from Northwestern University's Kellogg School of Management. Welcome, Sheila. Thank you for joining us.
Thank you, Deepu, for having me, and Dr. Day and Dr. Gupta. It's such a pleasure.
I'm so excited to have this conversation with you because up until now, we've had a lot of experts in the field of AI share their experiences and journeys. And I think we're going to zoom out a little bit with the conversation we're going to have with you from an organizational perspective and thinking more from a systematic and systems perspective rather than a singular perspective, which is what you bring. But before we dive into some questions, why don't you tell us a little bit about yourself and kind of what brought you to your current role and what you do in the role?
Yeah, absolutely. Thank you for asking, Deepu. So as you mentioned, I started my healthcare career at New York Presbyterian Hospital in New York City. I was essentially an analyst in their purchasing and buying group. And so for anyone that's familiar with the kind of US healthcare system landscape, the purchasing and buying groups in the hospitals honestly get kind of a bad rep. They're seen as pencil pushers, really just kind of order placers, not really organizations and kind of individuals that are thinking very strategically about purchasing within the hospital. And so what I loved about my experience at the hospital is that the group that I worked in, and shout out to Dr. Joshi, who is the head of our group, the group that I worked in was thinking very strategically about how do we purchase, how do we serve as a partner to the hospital the clinicians, and in bringing in devices and innovation that are really going to support patient care appropriately. And so really that experience kickstarted my love for healthcare, because I saw the impact that I was able to have in bringing in life-saving technologies into the organization in ways that can financially make sense. And so this intersection of healthcare and business is really what I've decided is sort of my passion and what I like doing. And so from there, I moved over to E&Y, as you mentioned, in their advisory practice, because what I realized is that while I loved working in procurement and purchasing, I wanted to understand the problems that hospitals were facing more broadly. And so when I was at E&Y, we did a lot of work around electronic medical records, how hospitals were thinking about bringing those into the organization. There was also a huge billing and coding change called ICD-10 that we helped a lot of hospitals prepare for. And so I got to see, just honestly, the laundry list of issues that hospitals were dealing with. And I'll kind of talk about why that was so important in a second. But it was just eye-opening to see all of the different areas that hospitals and other health organizations were really struggling to kind of manage the onslaught of change that was happening. And in that organization, or at E&Y rather, I started to do some work in digital. So this was back in 2011. And so quite some time ago. And even back then, we would have all these pictures of an iPhone with a doctor on it, and show, one day it's going to be Dr. iPhone. And this was back in 2011. And so we were starting to think about what the opportunity could be, but it was still so far away to really visualize. And then when I was at business school, I worked at Rock Health, which some of you may know is kind of a digital health accelerator. And we got to see some really awesome organizations kind of bringing really digital applications to healthcare. And it was a fascinating time. I got to do some work at J&J in their innovation center. They were working on a cardiac rehab app that helped optimize the way cardiac rehab ran. And then all of that to say, which has led me to where I am right now, as you mentioned, at LEK Consulting. I'm a managing director and partner here, and I get to take all of the experiences that I've had in my previous life, all of the great work that we've been able to do across the healthcare landscape in my current life, and really think about what should organizations do going forward? How do you manage all of this change? How do you think about digital more strategically and not be scared of it? And so that's a little bit of a long answer to a very simple question, but that's a little bit about how I got to where I am, and the sort of work that I get to do.
That's an amazing journey, Sheila, that I can tell the depth and breadth of experience that you've had in this budding space, right? You said 2011 is kind of when you started, and I was thinking back in 2011, what was the hot tech that we as clinicians were dealing with or learning how to adapt to, and that fast forward to today, with how quickly that has evolved for us from a clinical point of view, as well as a business and strategic point of view, and how organizations are really needing to pivot faster than they ever have in the current healthcare and healthcare tech kind of landscape. I would actually add a third circle to your little Venn diagram of business and healthcare, but it's also tech, right? Like they each kind of feed off of each other. And I think you do that very beautifully in the work that you've done. So fast forwarding to, you mentioned the doc on a phone and the technology that has evolved around it. So now we are here in the last, I would say, 18 months or so, with AI really just, I think, taking everyone by surprise, including industry and people who were very familiar with the industry, I would say, and how AI, and I guess specifically generative AI, because that's the landscape that we're in terms of digital health. How is that impacting the industry from your point of view? I can speak about it from a clinical point of view, but from a strategic and organizational point of view, what are you seeing in terms of the trends?
It's a fantastic question, and I'd love for your thoughts on this as well as a clinician. But to start off, the thing about generative AI, and the reason why it's so exciting, is that it makes AI more understandable. You can actually interact with AI, and we haven't been able to do that before. And so that's part of the reason why everyone's so excited by it, because it finally makes more sense. But in healthcare, AI has been around for a long time. And so one of the most common use cases is assisted reading for radiology, right? That's a use case that's been around for decades. It's getting better and better. And so I can't say decades ago it was working beautifully. I can't even say right now it's working beautifully. But the kind of concept of AI in healthcare has been around for quite some time. That obviously wasn't generative AI. It was more kind of traditional rules-based AI, but it's been around for a long time. The reason why generative AI, I think, in healthcare specifically, is just getting so much excitement is because now we understand potential use cases of generative AI that are just transformative. And so here's an example of a use case that I was reading about recently that a healthcare organization has started to think about, is where they've been able to take, they had an asthma patient. It was a 5-year-old asthma patient. And it was the first time this 5-year-old had an asthma attack, and they were trying to figure out the right way to really explain to this 5-year-old, what you need to be doing differently going forward. And so what they did is they took the discharge paperwork and they put it into generative AI, and they said, build me a coloring book based off of the discharge instructions so that the parents can actually go through it with the 5-year-old and have a more fun, kind of collaborative exercise where the patient can understand, oh, this is why I have to take my medicine. This is why I have to say something when I don't feel a certain way. And so that very specific use case, which frankly isn't really a clinical use case, it's just a interesting way of using generative AI in healthcare, has been transformative in really communicating and more effectively providing care to a 5-year-old patient that, was not going to just understand discharge instructions that their parents are telling them.
Right. Yeah. And that is actually a fantastic example of how we as clinicians are going to adapt how we explain diagnoses and various other things in clinical practice to patients, no matter what age they are. It's really meeting them where they are, whether it's cultural, whether it's a literacy level, whether it's an understanding for a 5-year-old versus a 65-year-old. Really, all of that kind of comes into play, and it really shifts how we practice and how we educate our patients. Right now, I feel like although we're taught how to talk to patients about their diagnoses, we're really not taught the nuances of how to culturally engage them, how to really engage them at their health literacy level, whatever that may be. And I think you're right, that is the transformative power of generative AI, where it can be conversational. And it is much more of a tool that's in our toolbox that really helps us enhance the soft skills that we really need to highlight as providers. So that's a great example. Go ahead.
No, so sorry. I think that's beautifully said. I'm sure you saw there was one of the big pushback around AI is, AI doesn't have empathy, right? AI is not a thinking human being. And so how do we think about AI in terms of, ensuring that we're including empathy as we talk about we talk to patients and we interact with patients. But then there was that report that was done recently that said that AI actually had better bedside manner than actual clinicians. And so how do you rectify reports like that with the kind of truth that AI is not an empathetic being? And really what it comes down to is what you shared around what AI allows you to do is customize, personalize, think about the individual unique kind of attributes and create a plan or create a conversation based off of that. And so really when we think about kind of the power of what AI is able to do in being empathetic, it's not, of course, empathy, but it's that personalization and customization that AI can give to the clinician to offer a better kind of overall patient experience.
Yeah, and it is truly bringing personalized healthcare, which we have been aiming for as an industry and as providers for decades now, right? The nuances of personalized and true personalized care, and it's really making it a reality for us. We have a long way to go, don't get me wrong, but I think the fact that we've been able to really harness generative AI and all of its power around natural language processing has really helped us make this leap. And the next leap will be the adoption that will come after it.
Totally.
Yeah. So when we're talking about that, and I think let's talk about some of the challenges that we have around adoption of this technology. You mentioned at the beginning, there's a lot of fear around this technology. I can definitely attest to that in my own experience. There's a lot of fear around, is it going to take away my job? Is it going to, is it going to be the patients are going to demand it, or was maybe not demanded, and am I going to not be able to use it the way I want to use it? Where do you see the industry from an organizational perspective moving in that area? I know there's been a lot of movement around organizations investing into the infrastructure around AI, but are there specific trends that you can point to where we're headed?
Yeah, it's a great question. And honestly, in my opinion, some healthy fear is important, right? Healthcare is not an area where you want to make mistakes. And so, if AI suggests the wrong t-shirt or stock to buy, sure, you're going to, buy a shirt you don't want, or you're going to buy a stock that doesn't perform very well, which, don't get me wrong, there's challenges and issues with that. But if AI suggests the wrong diagnosis, suggests the wrong treatment, that implications associated with that are much greater than, picking the wrong stock. And so some fear around really, how do we utilize AI? How do we think about the kind of litigious implications about AI being wrong? All of that is incredibly important. And that's even before I even talked about perhaps one of the biggest challenges with leveraging AI in healthcare is ensuring kind of diversity of the data that is training the models to ensure that we have an equitable kind of AI application, right? And so I feel like all I've done is told you everything that's kind of wrong about AI right now. And that's not what I'm meaning to do, more so to say that there are some pretty serious questions that we're still trying to answer as an industry before I think you're going to see more kind of widespread acceptance, reliance of AI. And I fundamentally believe that, in my lifetime, we're never going to see AI replace clinicians. AI is not going to eliminate your doctor, but AI will augment and will complement what they do. And so I think, over the next, I feel like things change so rapidly, so it's hard to say, but over the next couple of years, I think especially with Biden in the US, Biden had an executive order on AI and ensuring there's more transparency and oversight. I think over the next few years, I'm cautiously optimistic that we'll start being able to parse through some of those challenges around, ensuring that the data is kind of diverse, ensuring that we are thinking about the kind of litigation risks associated with AI. I think we'll figure that out over the next couple of years. And then from there, we'll figure out how to incorporate AI kind of into the workflows, not to replace kind of any of the clinicians or any of the clinical workflows that are currently happening. I'll pause there. Hopefully that
yeah, no, that was fantastic. It was fantastic. It was, you definitely, and I agree. I don't think you're overplaying the quote unquote fears or the negative aspects of AI. We have to, of course, think of all of these implications, ethical, moral, all of them, because at the end of the day, as you said, there's a human being attached to the decisions that we're making and the treatment plans that we're implementing. And so that bar is much higher than it would be in any other industry. And I think part of it, part of the fear, I think both from a provider as well as a patient perspective, is that, are we moving too fast? And I would say, I don't think we're moving as fast as theoretically we could, right? I say it kind of tongue in cheek in light of what we've just seen at OpenAI with Sam Altman and all of the things that's swirling around in new, but like, there is a level of urgency because from a provider perspective, what I see are clinician burnout rates increasing, the burden of documentation increasing. the volume of patients that you're being asked to see in any given shift or any given session increasing? And how do you balance the continuous strive that we have as clinicians to have the quality of care that we want our patients to have? Heck, I want my parents to have, or your parents to have, when they go see their provider, while we're augmenting and implementing AI into our practice. And I will say, I agree with you. I think it's not, you don't augment every aspect of your practice with AI. There are areas that it will naturally be part of your workflow. And there are parts where this is just not something that an AI or a bot can do. It's definitely better handled by a human being. And I think the engineers among our audience will know this. The human in the loop interaction is very important when we're building these algorithms and workflows. So I completely agree with you. I think healthy fear, healthy skepticism around all of these are important so that we can strive to make them better. The second point that I really like that you made was the diversity in the data, right? We cannot build, train, or implement any of these models if we don't have the right kind of data. And as we've learned from historical practice, a lot of the trials that were done in the past were done on a particular type of gender, particular race, and we haven't had that diversity in our research. And I think AI is really going to help us kind of improve that aspect of our care delivery. So while we're talking, I guess, of the not necessarily negative, but like while we're talking about what the challenges are, where do you foresee the data security and patient privacy in all of this? Since we've kind of talked about the quote fear of healthy skepticism and
it's such a meaty question, Dipu, and I wish I had the answer, because I would be, telling everybody that answer and then sipping a mojito on the beach somewhere. But unfortunately, the answer is very complex. So in the US, of course, HIPAA is an extremely important privacy kind of regulation that we have. And I would say what I've seen, at least in relation to generative AI, is that people are trying to be pretty careful about ensuring that there's no personally identified information that's being inputted into any of those forums, so that none of the models are being trained off of any personally identified information. So that, of course, is one of the biggest, as we talk to organizations, as we talk about how they think they should be thinking about their AI strategy. Our biggest recommendation is always ensure you are de-identifying, ensure you're pulling out anything that could be identifiable as much as possible, because that is, or not as much as possible, you have to, because that is the way to be compliant to those laws. And so I think, to your point earlier around, well, we're not moving as fast as we maybe could. I think part of the reason is because, and I believe in it, don't get me wrong, this is not a fault, but part of the reason is because we have to figure out how to work in constraints of all of these data security and privacy kind of rules that we have in place. And so if you ask me, I actually believe that in some countries like Africa or even in India, where the risk associated with not utilizing AI to help improve healthcare access is so high, that because it's so beneficial to utilize those models, I actually could see us moving faster with leveraging things like AI in those countries than I think we can in the US as it comes to clinical use cases. I'll pause there, because I think I sort of started answering a different question that you hadn't even asked me.
No, that's I'm actually smiling because I think Amit would totally agree with you, because he is implementing it into his practice and has had quite a bit of success. But I'll let him chime in at a later point in the podcast, because I think he would absolutely agree with you that the pace at which we can implement these, you're right. We have constraints here in the US, and I'm not saying they're bad constraints. They are constraints there, they're valid, and we need to learn how to work within that system. But you're right, that innovation factor, the adoption factor is definitely going to be higher in countries where, of course, there are privacy laws in
Yeah,
India. I'm not saying that, but
course.
the rate of adoption will be faster. And
Yeah.
I'll let him talk about that. So you mentioned that organizations, of course, need to take into account existing privacy laws and data laws. What other components of a strategic plan should an organization take into account when they're sitting here? Let's say January 2024 is right around the corner. A business is about to start talking about what their strategic plan will be for the next 3 to 5 years in terms of adopting AI or some part of AI into their practice or into their organization. What are some key components that they should take into account?
Yeah, it's a great question. So I think, before I answer it specifically, going back to something you mentioned earlier, there's a lot of fear around AI. And so to be honest with you, a lot of the time when we're having conversations with our clients, they don't know where to start. Their clinicians are scared of it. They don't really want the hospital be investing that much of their time on it, even though there could be, to your point earlier, very significant use cases that help eliminate things like clinician burnout. They're scared. And so, what we always tell our clients is, it's okay to be scared. There's a fear of AI that is healthy, but also remember that AI use cases don't need to all be extremely transformative. Yes, there are definitely some AI use cases that can help with treatment planning, surgical visualization, even smart implants that leverage AI. All of that is amazing, but there's also really tangible, more near-term vetted AI use cases that you can start thinking about in your organization. And so we always tell our clients is, what are some of your key pain points? And so one use case in the US, for example, that has really gained a lot of traction is revenue cycle management. And so it's not very sexy, right?
It's definitely not sexy.
No, it is not. It is not treatment planning. It's not early diagnosis, but it is, how do we ensure we're getting paid? That's the kind of very basic sense of how to think about what revenue cycle management means. And what we're actually seeing is that you can utilize AI to improve the kind of claim denial rate. And so what that essentially means, for those that aren't familiar with those words, is you can ensure you're getting paid more often. And you can ensure that you're not wasting a lot of time going back and forth with the insurance companies on managing different claims. That saves significant time, it saves significant effort, and it improves the amount of money that you have coming in through the door. That is huge, a huge area of very specific and significant near-term benefit to the organization. And so what we always tell our clients is, what are your biggest pain points and how can AI help them? Sure, maybe one of your biggest pain points is we're not able to, find as many cardiovascular patients as we know should be in our population. But one of your pain points might just be, we can't figure out how to schedule our clinicians appropriately given patient demand.
Yeah.
That is a great use case for AI. And so we just say, be a bit more honest with yourself about what you need help with and start taking baby steps. Another great one that we saw recently was a hospital was having a lot of trouble keeping up with the volume of contracts that they were kind of getting through the door. And we talked to them about, hey, maybe you can use generative AI to do a pre-read of contracts based off of historical precedent that you have established with other vendors. And that can eliminate a lot of time wasted reviewing a contract again. And so take baby steps, think about your biggest areas of unmet need and where AI can plug in. And as you develop kind of comfort with AI, as you develop just the internal skill sets to manage those applications, you can then start thinking about what's next.
Yeah.
So very long answer to a simple question again, but hopefully
I think that was fantastic. And the examples you gave are really fantastic. And I agree with you. I think what I'm hearing you say, if I may just extrapolate from in terms of generalizability, is that engage your stakeholders, engage the people who are actually going to be doing the work, and ask them what their biggest pain points are. And sometimes that may mean starting small, like pick a department, pick a, or pick a workflow, or pick something that where you're like, to your point around revenue cycle, and saying, the billing in this particular department is particularly low. We're seeing a lot of high claims denial rates. Let's look at that one first and see what where we can improve this. I will also say that this does take not only technical expertise, but it takes a technical infrastructure for you to have that kind of level of solution that's going to be implemented. But the first step, to your point, is really addressing stakeholder fears and engaging them and asking them, what do you need? What can we make better for you? And I think after a really long time, and having worked with many of bean counters myself from a clinical perspective, for the first time, I think there is a parity around, like, if I can make this happen for you, what are you going to be able to do to improve your, not only your personal life or your professional life, but also it will help increase revenue in the long run for these organizations, because you'll have a clinician who will be able to provide high quality care for patients just by tweaking a workflow with AI, right?
Really.
So I think you've got it. So it's about engaging your stakeholders, allocating resources and expertise where it's needed, and then if you need to start small before you start scaling up on a larger level. And if I may, put the patient at the center of it all, because at the end of the day, they're the glue that kind of holds every decision we make from a healthcare organizational perspective at the center. Yeah.
Totally agreed. And there was a study that was done a little while ago around, they asked kind of consumers or patients, how comfortable are you with your organization leveraging, your healthcare organization leveraging AI? And I think it was, more than 50% said that they would be very comfortable with that. And so not only should we, as healthcare kind of ecosystem players, be utilizing AI for our own optimization, but our patients are hoping we are. And they want us to be leveraging the power of this technology for their own benefit. There's, of course, a whole host of questions around how we do that and the laws associated with it, right? Everything we talked about earlier, but they're hoping we will. And they also realize that there is a lot of value in leveraging things like this. If I can go on a tangent for just 1 second, for example, WebMD in the US is sort of every clinic, as a clinician, I'm sure is your worst enemy, right? But people are using ChatGPT in a similar way. And so I had a clinician tell me the story recently where they had a patient come in with kind of printouts of, the questions that they had asked ChatGPT. And to be honest with you, the answers weren't that bad. And, as clinicians, and, of course, please don't let me speak on behalf of clinicians, because that is your role. But as clinicians, it is important for us to understand, what do we do with that information? How do we handle that when the patient comes in with this information? It was easy-ish to kind of rule off WebMD and to kind of point them elsewhere. But when ChatGPT is giving pretty good answers, how do you as a clinician then engage with that?
Right. And again, I'm not going to answer for every clinician, but I think, to me, if a patient came to me with that information, it would be more like, that's wonderful. I'm so glad you had those questions. Let me see if I can make them a little bit more specific to what you have, and in the context of your comorbid conditions or your cultural context, right? So to me, I agree with you. I think a lot of patients are going to do that. In fact, I know a lot of patients will. This is not any different than, Googling your symptoms, although I will advise most people not to do that. But you're right, and ChatGPT, as good as it is not everything, and does hallucinate answers every now and then. And so it does behoove us as clinicians, one, to be aware how these models are trained, two, what version of the model the patient was using, and then three, what questions did they ask? Because the way we ask a question as a clinician is going to be very different than the way a patient asks a question. And sometimes And this is again a whole other conversation, but like how you ask the prompt really will change the way the LLM will put the what the output will be from ChatGPT. So I agree. I think this is like it's a whole other way of really engaging with the patient and personalizing their care. Because I think if you dismiss what they bring to you, it's going to, one, make you feel like make them feel like you're afraid of it. Two, that you don't have all the answers. When in reality, I do tell my patients, I don't have all the answers. Like, I mean, there's just no way it's gonna happen. But I will say, I'm here to tell you that neither does ChatGPT. So I think it's the best of both worlds, so that when you put them both together, to your point, when you augment your practice with it, I think it really enhances the quality of the care you can deliver to patients.
That's spot on.
Yeah. So we talked about what we could do for strategic planning. Can you give me some examples of organizations that have successfully embraced AI, and like what strategic moves they made or best practices that they had to implement and what their outcomes were?
Yeah, for sure. So I think when I answer this question, I'm going to start broadly, because I think for most of the conversation thus far, we've been talking about the provider landscape, so kind of healthcare, like hospitals and health systems. But actually, where we've seen AI most adopted to date has more so been in the pharmaceutical landscape. And so there's been a lot of use cases around AI with target discovery and drug development, and really helping to improve the way that we are as an industry are identifying new potential drugs. That is a game-changing technology. It harkens back to the conversation we had earlier around personalization and customization. It's allowing for that to happen. And so that's actually probably one of the most advanced use cases of AI in healthcare that we've been seeing more and more. And I would say most pharma is, if not kind of, if they're not talking about leveraging it, they are leveraging it. I would say on the hospital world, it's a little bit of a different story. I think every hospital is at a little bit of a different stage. Obviously, the Mayo clinics, the Cleveland clinics, the Kaisers, they are doing a ton with investing in AI, thinking about clinical and non-clinical use cases. So Rev Cycle is a great one that I mentioned earlier, but then early diagnosis, treatment planning, surgical visualization, they're leveraging AI or they're trying to leverage AI in all of those areas. I would say, they're probably seen as the sort of leaders to date in all of those different use cases. But I think a lot of kind of smaller progressive organizations are also trying to take their lead and invest in those use cases as well. So hopefully that answered your question, but I think in health systems, we still have a ways to go.
Yeah, I mean, I think you're right. I agree, the Mayos of the world, even in New York City, Mount Sinai, all of those hospitals are definitely making inroads into this space. I will give a shout out to the smaller health systems and organizations, because they have the ability to pivot faster than the large organizations. So from an organizational perspective, don't count it out just because you quote unquote think you're a small organization. In fact, I think you can leverage that to your advantage. So I'm going to bring Amit in. I think he has a couple of questions, and I do want to kind of circle back to our conversation about how he incorporates AI into his practice and how innovative he is. So I'll let you take it away, Amit.
I'd love that.
Yeah, I guess both of you have been having a very engaging conversation, and I've been kind of hearing the entire context of how you're exploring this landscape from the viewpoint of a healthcare organization. And to all our viewers out there, and I believe we always have a diverse viewers, clinicians, and even some people from the AI industry always joining in to see how we explore AI. So there's one thing that comes to my mind very clearly, and if I can put it in one line, that for the healthcare organization, uh, artificial intelligence is going to help you reach with the right resource to the right person in the right time. I think if I can just phrase it in the right way, I mean, that kind of sums it in saying that you're going to save a lot of money, you're going to channelize a lot of your resources, have the right kind of doctor attend the right kind of a patient, have the right department look into the right illness, do a good amount of a triage starting from your emergency department, and to go on. Healthcare data is going to be very diverse, and so they're very important that every healthcare infrastructure comes up with their own LLM. So that takes me to one question back to Sheila, that from a healthcare organization point of view, where do they start? I mean, you start with having an AI department, or you look for a chief intelligence officer or something of that sort? Sheila, your thoughts?
Yeah, it's a great question. And honestly, no one really has any of the answers yet. I'm gonna be I'll be honest with you. Um, a lot of hospitals over the last, especially during COVID, set up digital organizations. They hired a chief digital officer. They were investing heavily. And then, as you may have seen over the last year, some of those organizations have actually let go of those individuals and those teams. And it's not because they're not investing in digital, they're just trying to figure out, how do we set this up so that it's not a separate part of our organization and it's integrated into our core clinical and non-clinical workflows. And I think that that issue or that kind of question is still being solved. And so what we recommend to our kind of organizations that we work with is, you do need to have, and Deepa, you had pointed out this earlier, how do you think about your operating structure when it comes to digital? Sort of, where does it sit in the organization? How do you ensure whoever or the team members responsible for it aren't sitting on an island? Because it's not kind of the service and then digital. It's how do we put it all together? And so those are those sorts of questions that everyone's trying to figure out right now, to be honest with you, and setting up those workflows to allow for the digital kind of lead to be fully integrated into the clinical and non-clinical teams is what a lot of organizations are trying to figure out. But I would say over the last 2 years, the separate team that was sort of on their own island, that seems to be going away in favor to more integrated teams. But let's see what happens going forward as organizations think about this further. I think that the kind of good part, to fully answer your question, just to, because I realize I'm going around a circle a little bit. The good part is that no one has the answers, and so we're all working together to figure out the way it works. The bad part is that no one has the answers, so we need to all figure out how to work together to ensure we come up with a good plan. But that at least has been my experience. Deepu or Dr. Day, I'm not sure if you guys have other examples of those that have worked.
Yeah,
I think
I kind of agree to what you just said, and I've been speaking to a couple of my friends and peers across the Mayo Clinic and Cleveland. I guess they're coming up with some strategic plans of adopting AI into certain departments.
Mhm.
And but yes, as you rightly said, Sheila, that everybody is trying to figure out the best way of investing into AI, not go overboard with the investment, but at the same time take it slow. And
Yeah.
I guess a lot of HR policies will also come in, because there's always going to be a fear factor of the the organizational employees having this backset mind that they might be replaced, the repetitive tasks might be taken away from them and given to an AI model to work on. You just give a very beautiful use case scenario where discharges can be kind of transcribed using an AI tool in the best possible way for the individual to comprehend and learn, whether it's a 5-year-old child or whether it's let's say an 80-year-old person with cognitive impairment. So I guess that's exactly what most organizations are kind of figuring out as to where they start. The other aspect I wanted to kind of discuss with both of you, coming from a country like India from my side, and I would probably represent a lot of voices from Southeast Asia and the other parts of the world, is the whole concept of artificial intelligence is going to kind of bring a dynamic change in the healthcare equilibrium. Now, we've always realized that there is something called the standards of care, and in certain parts of the world, the standards of care are only those for the privileged. I think that equilibrium is going to change when you have a proper AI tool coming into the healthcare infrastructure, because that again takes you back to that point that you can reach out with the right resource to the right individual at the right point of time. And I think that will make a huge change in the whole healthcare industry. in the way it flows, in the way the investments are made, in the way the marketing strategies are planned, and in the way I would say the both the public and the private health sector is modeled. I mean, you might speak for your country, but in a country like India, we have got a different model running in the private health sector, which is somewhat driven by the insurance and by the cash flow patients, and then there is the public health sector, which runs, with the government sort of a model. So there would probably be different structures coming in for these different healthcare structures, and probably it would do a lot of good in equitably distributing healthcare, because at the end of the day, we know it's a basic human right, but still becomes a challenge to reach out to the right person in the right point of time. I think that's where it's going to come in, and it's going to probably make a lot of difference and a lot of change in the healthcare outcomes, and most importantly in the healthcare cost. I guess that's going to come on the individual as well as on the insurance company. So Sheila, what are your thoughts on this part about the whole dynamics of healthcare ecosystem being changed when hospital would start adopting in practice artificial intelligence tools into their day-to-day practice?
Yeah, that's a really meaty question, and I'm sure Deepu has some amazing thoughts on it as well. So I can at least get us started. One of my favorite questions to ask folks is healthcare a right or is it a privilege? Because I don't think as a society we have a good answer for it. And I fundamentally, one of the most exciting things about AI, to your point, Dr. J, is that it makes healthcare a right. I think the challenge, though, in my opinion, I don't have a good answer for it, but the challenge is how do we rectify the kind of financial needs of some of these AI companies with the fact that we want to make it accessible to everyone? Because OpenAI, for example, started as a nonprofit. Obviously, Microsoft made a very, very big investment in OpenAI. They're not an owner. I think they're at 49%. But that now means is they have obligations to Microsoft, which is a publicly traded company. And so how do we think about leveraging these AI tools that are not running as nonprofits? They're running as financially motivated organizations. And so I don't know the answer to that question. How do we ensure that this technology can be utilized to the point you made earlier, Dr. Day, in a way that allows for equitable care, finally, while also allowing what they need to do, which is financial kind of gain? And so I don't know if I have a good answer to that, how we will get there. But I agree with you completely, is that this allows for a level playing field in terms of healthcare access in a way that honestly no other technology has been able to before.
Deepu, your thoughts?
Yeah, no, I would agree. And I asked the exact same question, as healthcare a right or a privilege, when I teach health policy to our PA students, because the opinion is still very varied, especially in the United States. I would say that no one person kind of agrees on right versus privilege in the state. I do agree with you about, theoretically, AI has the ability to democratize healthcare, at least access to healthcare. I don't know if it will truly democratize healthcare and the outcomes overall, but at least at this early stage and early phase of where we are, I think access to care can certainly be democratized, I would say, in the next 5 to 10 years. The WHO actually put out a really great report on digital equity a few years back, even before generative AI was on the market. It outlined how organizations and countries can go about kind of laying the foundation and the strategic plan for democratizing access to care. And again, we're talking about access. Outcomes are a whole other ballgame, I think, and that is very dependent from region to region, country to country, right? But you're right. I think, how do you balance a for-profit organization that is leveraging generative AI to impact access, outcomes, what have you, from a patient perspective, with what we struggle with that is considered a right. Like I think personally, I think healthcare is a right, but that doesn't mean that everyone feels that way, and that companies, certainly at least for-profit companies, make it very clear, but nonprofit, you're right, it gets fuzzy. It gets really, really fuzzy. And are we on the brink of perhaps a new model being created of how we can be for-profit, nonprofit at the same time, but still deliver what we want in terms of access to care, or whatever the mission of the company is. So I think it's evolving. I don't have an answer. I would love to have an answer, but you're right. I would join you with the mojito on the beach, Sheila, if I had an answer. But I don't. But to me, at this stage, that's what makes healthcare really exciting. I do feel optimistic about where we're headed. But again, it's a healthy optimism versus a fearful skepticism. And so that's the kind of the scale I kind of oscillate between on a daily basis with this.
Yeah. Beautifully said, Dipu. And I think, to the point earlier that we were talking about with why I think some countries like Africa and India, I think are perhaps going to be able to be further ahead in leveraging technologies like this for these reasons around improving healthcare access. And Dipu, I love the bifurcation between access and outcomes, because that's spot on. And part of the reason is that in the US, let's say we are able to leverage technologies like this in kind of areas where there isn't as much healthcare access, but let's say something goes wrong. Who's to blame then?
Yes.
Right. And we don't know how to answer that question.
Right.
Whereas
litigious aspects of our care definitely override our ability of good Samaritanship, I guess, for lack of a better, right? And I think
I kind of agree to both of you out there that, even this is something that I personally feel, that the adaptability to the newer technologies, artificial intelligence tools in a country like India and in many parts of other parts of the world would probably be much better than it's out there with you folks in the West, simply because there is a need. There is a need for change. There is a need for development. There's a need for a structure. And wherever there is a scope of structuring something in a more equitable way and in a more affordable way, probably that will kind of find its place in the society. Having said that, yes, we do understand that probably the ROI, or the return on the investment at the moment on the AI, would not be huge, but going ahead, probably healthcare organizations need to look at this as kind of a long-term investment, and it would definitely help you coming up with a more structured way of reaching out with your healthcare methods, to the entire diverse section of the society that we look to cater to, in most of our places. So the other also important aspect is that it would require a lot of integration amongst probably three partners. One is, of course, the doctors, the healthcare um, strategic planners, the investors, and of course, on the other end, the AI scientists and the data analysts, etc. So I think that integrated work would be required. It would probably require, every hospital would require a room where these three components can come and brainstorm and build up your own regional large language model that would run in the emergency department and in the OTs and in the critical care department. Have your own sepsis model, have your own antibiotic policy model. I mean, just stuffs like that, that would just define your own standards of care in your very own local regional way. That would probably take healthcare to a completely different new level than where we are. And it would also help us in globalizing healthcare. I think we have already globalized healthcare with the help of technology and communications. I think with the help of artificial intelligence, we'll be able to globalize healthcare further. And just I would kind of rephrase what I just said, like, reaching out with the right resource to the right person in the right point of time. I think that's going to save the life of many. Wonderful discussion today, Sheila. I mean, fantastic inputs and insights from you. Thank you to Deepu as always. But before we end, can we have Harshita? I'm sure our audience might be having a couple of more questions as we come to the end of this beautiful episode. So, Harshita, any questions for us?
Yeah, so we have received questions from our audience, and some of these have already been extensively covered in the conversation. So here's the first one. In what ways can AI enhance not just operational efficiency, but also contribute to the overall resilience of an organization?
All right, fire on, Sheila.
Yeah, I can definitely get started, but I'm sure Deepu has some thoughts as well. So I think we talked about one of them, which is around revenue cycle management. And so that has very specific impact on the ability to make more money. And it's probably the most simplest way to put it. And so there are very specific use cases around AI that can help very tangibly quantify, or you can quantify the impact of it on your bottom line. And so that is one area that we've seen a lot of value. But there are some other areas where we've seen value, more so on the kind of time savings, which then should contribute to people spending their time on more kind of higher quality, higher impactful activities. And so another one is like utilizing chatbots to kind of communicate with your patients, answering simple questions for them, directing them to the right individuals or the right departments. And you can utilize that. You know, there are chatbots today that you can utilize to interact with your patient groups. And that should ideally save you a lot of time in managing those basic questions that can be programmed and answered by kind of AI. I'll pause there. Those are some of the very tangible ways that it can improve the operational efficiencies of a healthcare organization. But Deepu, anything else that you'd want to add?
I think the chatbots, I think you point out, are actually very, very interesting. These are not the chatbots of yesteryear. Generative AI and LLMs in general and natural language processing have really improved the delivery of these chatbots and how these bots engage with the patients. And if you look at that engagement in terms of time saving, Sheila, you mentioned it as a time saving kind of point of view from a clinician, but also it is a patient satisfaction metric, at least in the US, and I think anywhere. You want to make sure that the patient's needs are addressed in a timely manner rather than them having to wait for you to call them back 2 hours later in between patients, right? And so a bot can certainly answer a lot of questions. Now, they're not 100% foolproof, at least none that I have seen. And so when we're talking about medication management, tweaking doses and things like that, I'm sure Amit will agree, you don't want a bot quite adjusting an insulin dose or a metformin dose, but at the same time, there are certain guardrails that you can put in place that will improve patient satisfaction in the long run. Amit, go ahead.
Yeah, I guess this is a very interesting kind of a point there. And, what I see these kind of chatbots going to do is that it will definitely improve the communication between the healthcare provider and the patient, right? At the same time, we have to be using it very, very carefully. Now, I'll give you an instance. For example, we have app connections with our patients, which are interlinked with our electronic medical records, something that we are already using. What we have seen that these connectivities basically improve patient care. It kind of reduces your patient's loss to follow up. It improves the compliance, and thereby it will definitely have an impact on the clinical outcome. So, having said that, these chatbots using the NLPs would probably go one step ahead in kind of filling up those communication gaps, which probably would be missing between the hospital and the patient, or the healthcare provider and the patient. But again, they have to be regulated and used very, very, very carefully. But I would definitely say, Sheila and Deepu, that these chatbots are going to be a huge asset to the healthcare organization in improving their revenue, for the simple reason that a lot of patients will not be lost to follow up. A lot of patients will be triaged and brought back to care in the right point of time, and therefore it would definitely improve the revenue generation of the hospital if you look at it from the ROI point of view. So that's a very good point you brought out there.
And I will just say, even if we just use these bots to follow up and say, hey, I noticed that the last time you saw Dr. Day, he asked you to make an appointment with
Right.
this specialist in 3 weeks. I noticed you didn't do that. Can you do
Yes.
that? If we just did that, that would significantly improve follow-up as well as the care and also quality of life of the patient, right? Like, because it absolutely, just that one simple thing would be game changing.
The only thing that it will require is a good regulation and being used in ethically. That's very important. That's going to be a key factor there.
Yeah.
Harshita, any other question? We're almost to the end of this podcast.
Yeah, we have covered other questions. So yeah, thank you all for thank you all for sharing your tangible, helpful, and inspiring thoughts.
Once again, thank you very much, dear friends, for joining us. And once again, thank you, Dipu. Thank you, Sheila. We had a fantastic discussion today. And thank you, Sheila, for joining us with all your insights. I think it was really invaluable kind of inputs that you've given to most of our viewers. And maybe some healthcare entrepreneurs listening to this would have some great ideas coming up, popping up in their mind. And who knows, some might just get interested or inspired to start with a AI department in their hospital. That's the whole focus of our podcast. We want to make a change. We want to sort of give you the right information in the right time, because we are all adapting to this change, and we want you to stay curious, and we want to learn from each other. Dipu, over to you for the final words.
Thank you so much. I really wanted to thank Sheila for her time and expertise during this holiday week in the United States, at least. And I want to wish all of our audience a very happy holiday season. We'll see you in a couple of weeks for our next episode, where we'll be talking about data. So there'll be a lot of meaty and technical conversation to come. But in the meantime, thank you, Sheila. And Sheila can be found on LinkedIn. You can certainly reach out to her. We'll put her LinkedIn profile linked in our comments at the podcast. Thank you so much, everyone.
Thank you.
And audience, mark your calendars for December 4th as we return with our next episode, where our experts will guide us through the foundational role of data science in AI and its impact on clinical care. Be sure to tune in on the 4th of November. And before we conclude, I encourage you to explore our MedSynapse platform. It offers a unique opportunity to engage in enriching discussions, connect with esteemed medical professionals, and contribute to the progress of healthcare. Until then, stay curious and stay informed. Goodbye.